One of the things that I've kind of created for my book of business, we've got about 1,000 Medicare MAPDs on the books. Right? I don't have the capability nor the desire to call these seniors. Okay, I don't have the time bandwidth. So you got to create some automations, some workflows. Okay, now I've got that built out. I've got an ANOC workflow that then ties into an AEP reminder workflow that's built into my CRM. So agents, if you're not doing something like that, number one, consider getting the CRM and build these out yourself, or you can use my stuff and it's already in there. Otherwise, your other alternative is you hire somebody. Get somebody to call these seniors and, hey, Mr. Senior, you get your ANOC letter. You know what? Let's review it. Let's go over the changes. I agree. It's going to be a year of turmoil, a year of disruption. We got an election year on top of that too. A lot of stuff is going to happen. I think it's going to be a little slow at the beginning because of the election year, and then it's just going to be crazy towards the end. But let's talk about some practices that might help us with getting this data from these seniors. And let's look at RetireFlow and then the possibility of having Sunfire do some of this.
Perfect. No, thanks for bringing full circle. Obviously we need to make sure we're ready to sell, recertified. We're proactively reaching out to our clients. But now, like Luis mentioned, we need to start streamlining what we're doing. So obviously, if you have, a book of 300 or 500, it's going to be tough to call every single one of them. So we have a good relationship with a company called RetireFlow. They're out of Columbus. So Dalton, who's their CEO, is a Buckeye like I am. They have used their agency kind of as a springboard. They're from the agency, world, so they understand the process. And essentially what RetireFlow is a 13-question survey that you are able to send to your client in a link. And it's essentially going to handhold them through the process of collecting a lot of good things. So it collects doctors, drugs, pharmacies. It also secures things such as consent to contact. We like that, as well as a scope of appointment, which we know with the 48-hour rule, getting a scope of appointment, before we can talk benefits is tough too. So what RetireFlow is traditionally, I've heard stories of an agent that had 900 folks, sent out this link on a, Friday, got back on a Monday after watching Ohio State football, already had 78 folks respond. And he had 78 folks that had doctors, drugs, opt-in calls. So he had 8% of his book already reach back out saying, this is 8% of your day that you no longer have to do prospecting, folks. So he ended up doing that email another 4 times leading up to AEP. And at the end of it, he had about 300 folks that had put in information. So a third of his book, obviously there's going to be folks that you have a tough time tracking down, but he had a third of his book that had filled out RetireFlow. They had consent to contact, and he was ready to call. What I will tell you in terms of cost, traditionally per user, it's around $50 a month. It's going to, collect all of that information for you. There's a dashboard that you can click and download the PDF, the scope, upload that into Sunfire. You're good to go. Then you can start plugging and chugging those doctors and drugs in. The drugs are never wrong because there is a routing through Medicare.gov. So as long as the client knows the first 1 or 2 letters of the drug, it's going to pop it up. And it's also smart enough to know if the drug is a generic or non-generic drug. So if they put in a drug, it says, are you sure you meant that? Or did you mean atorvastatin? And then also they can put in as many docs or as many drugs as they'd like as well. Good news about this is traditionally, like I mentioned, it's usually $50 a month. With SMA, we have a promo code, capital SMA 40. So it's just 4 digits, and that'll save you 40%. So it'll get you down to, $29.99 a month. It's not a contract that you have to sign for a year. It's a month to month. I haven't had a person yet reach back out saying, "Hey, I don't see any value here." So, good opportunity to utilize that software and start collecting info in real time. So, and then to add on to that, Lewis, you also mentioned Sunfire. So if y'all are not using Sunfire, I will tell you flat out, you are missing out on streamlining your enrollment process. It's a portal that I use. It is one that we recommend and train a lot. They are in the final processes here in about a month. I called them earlier today. So we're looking at September 15th-ish is what they say. They always throw a tentative date. They are going to roll out a very similar RetireFlow process that's going to essentially be called Phoenix. And I can send you a quick video of it, Lewis, that you can send to your team later.
Perfect.
It's essentially going to look very similar, where it's going to be a link that goes out to your clients. They can fill in their docs, drugs, so on and so forth. So good thing with that, unless something changes that I am unaware of, Phoenix is going to be included in the cost of Sunfire, which we pay for anyway. So if you're wondering, how should I go RetireFlow? Do I need to look at Sunfire? We're not partial. We just want to make sure you can get out in front of as many clients as possible. But what I would tell you is, waiting a month and not doing anything, waiting for Sunfire, just because it's maybe a simpler process, or Jeremy's writing the check for it. I would stall. I would, if you're wanting to say, hey, I'd rather wait, for this to roll out and use somewhere that I'm familiar with, I have to worry about another, RetireFlow or another platform or features that you need to learn. You can certainly do that, but I would highly recommend in this month's time, if you choose to wait, still be proactive, still hire that assistant to schedule, ANOC calls, and make sure that you're being proactive as much as you can, just so you're not wasting any time.
Perfect. So what I just heard Jeremy say is maybe get RetireFlow right now. Okay. Get it right now for about a month or so. And then when Sunfire has their tool ready, because RetireFlow is not a contract, you can cancel and then maybe pick up the workflow on Sunfire where you don't have to pay. $50 at 40% discount makes it $30. Guys, man, I go buy 30-piece chicken nuggets at Chick-fil-A for my kids, and I already spent $30. So don't tell me you guys don't have the money. I know what you guys are. You all are just tight asses with your money. But remember, you need this, guys. You need this as a tool to get with your insurance so that you maintain your book. Otherwise, you're going to get some very hungry agents take the book away from you. And then you'll be out more than that little measly $30 charge. Okay. Yep. Any questions so far, guys? I want to go over the last topic. Any questions on the Part D changes, RetireFlow, Sunfire, the premier quote and enrollment tool for Medicare? What do you got, guys? Hit me up. Like, you can hit me up and I can just gonna deflect the question to Jeremy. So come on. Don't be shy. Come on, I got the chat going. If there are no questions, not a big deal. Here's what I'm thinking. Jeremy, you are an agent out there. You probably talked to thousands of agents. What do you think are going to be 2025 AEP best practices?
Perfect. Yeah. So listing it out, 2025 is going to be here before we know it. So essentially planning for your AEP starts now. This is, if you're an agent right now that's not done their AHIP, they've not recertified, you've not ordered, the kits are certainly about to come out for carriers if you don't have that check mark. And if you haven't started looking at first looks, those are things that need to be buttoned up, this week, next week at the absolute latest. Biggest practice this year over last year is, we all know agents. You might be one of the agents, that waits until a couple weeks before AEP, cracks open the laptop for the first time. With these ANOC letters going out, it is going to be the biggest shopping year for Medicare since 1965 when Medicare started. So best practice, Lewis, you brought up a good one. We're actually recommending folks just based on the size of their book to start delegating, someone to come in, 4 or 8 hours a week, to, work for, $15 an hour just to schedule phone calls for you, just to do reviews. We're also recommending to do exactly what Lewis is doing right now, which is a webinar, which is getting you guys on for a training. So, certainly work with, Lewis on, hey, can we set up a Zoom call for me and my clients? How does that work? We're also saying if you're not working with companies like Centerwell or, the Oak Streets of the world, lean on those value-based care groups, because what they also have is meeting rooms for you to get a meeting room assigned to you for a day, so you can have 30 or 50 of your agents. Bring your ANOCs, bring your friends. We can do a Medicare 101 for you. That's a great opportunity as well to get out in front of them and say, hey, we are seeing some changes. No need to fear. Who's standing in front of you today is going to, be here to help you with those things. So biggest thing we're seeing this year is get out in front of your clients now, set those expectations, and then start scheduling pre-AEP appointments. So when I managed my agency, so I stood up a telephonic team of 15 agents. We wrote about 3,000 policies between the 15 of them. The biggest thing I told them is I should be able to realistically turn the phones off from October 1 until October 15th, because your entire schedule should be nothing but presentations. We've used RetireFlow, we've used Sunfire, we've gotten these docs, we've gotten these drugs. I'm going to start scheduling clients every 30 minutes, and all I'm doing is presenting policies. Mrs. Jones, here's the docs, here's the drugs that you sent me. Let's go through a needs analysis. What do you like about your current plan? What don't you like? What would you change? And then that's essentially going to be the exact same process for AEP as well. So I told my agents as well, the first 2 weeks of AEP, I should be able to turn the phones off. And you should have from October 15th till realistically November, but Mrs. Jones, we've talked, 2 weeks ago, I wasn't able to enroll you then. Here's your 25, 15, 20 minute, enrollment window. And we're calling clients just to enroll them. So realistically, your first little bit of AEP is going to be folks that are nothing but enrollments, because you've already put in the work, you've already gotten their commitment to an enrollment, and you were just calling them, getting them good to go. What I'll tell you is there is going to be slow weeks. Obviously, it's an election. Thanksgiving's always slow. We always see lulls, mid to late November with folks going over the river and through the woods to do Thanksgiving. And then they tick back up first week of December, and there's a big final push. So we know if you guys are, doing call campaigns, or if you're, doing events, or you're, working leads, lean on those certainly the back half of November, just so you don't hit a rut and then get overwhelmed the last week with all these people calling back in. So that would be my recommendation on how to run your AEP. In terms of retention, how I ran my team and how I ran my clients is once AEP is done, we know that Christmas is great. We're going to spend time with our families. December 8th hits. Woo! My big money-making portion of the year is done. I would give it, give you time to celebrate, give you time to take a breather. But for sure, the week before Christmas, 2 weeks before Christmas, call those clients you just enrolled, and I would always call from October and work your way towards the current and say, okay, I'm calling Mrs. Jones. We enrolled you, in this, Anthem policy, wanted to make sure that you got your card. Great. Wanted to walk you through any benefits. Do you have any questions about how to utilize over the counter? And then great, let me schedule you your doctor's visit for your first primary care visit for the year. And it gets the client using those beefy benefits you just talked about, and then you're off to the races. So that's how I would set up my AEP. I'm sure we will talk more as the new year hits. We should be seeing a pretty similar AEP this year and a pretty similar OEP next year. But for 2025, just to get you guys, more privy to what's going to happen next year, is how dual special needs, how we look at election periods is going to change a little bit next year. So I don't know, Lewis, if you want me to give you guys a little highlight, happy to do that.
Sure, let's do it. It's a great platform. Let's do that. But you know what?
Perfect.
Before you do, I'm going to ask you, I have one private question that hit me up. So we're talking about maintaining your book and focusing on that. So one of these agents, and we do have some new guys to Medic in here. So we're talking, hey, focus on your book, focus on your book. What advice would we give an agent who doesn't have a book that is new to Medicare?
Great question. So like we talked about, there's going to be folks that are maintaining their book, this AEP, and then there's going to be folks that are going to be going after market share. So if I was a new agent, obviously, it would come down to, is that agent going to be working events? Is that agent going to be, doing over the phone work? My recommendation is, if you're not talking to a client, you need to be doing everything you possibly can to talk to a client, because time is money in this industry. So, we can certainly, provide some insight on vendors we're seeing that's working well. Like I mentioned before, value-based care is great. I would also challenge any new agent to know your market and know your market managers. So if you're not familiar with, the area that you're in, lean on Lewis, lean on myself, so we can get you introduced to those local leaders for Humana, Anthem, Cigna. I don't know if you know these carriers, but they love people that write their business. So if you walk up to them and say, hey, I'm a young gun, I'm looking to get plugged in, can you help me with an event? Can you point me in the right direction? There's people around you that want you to sell their product. So as a new agent, my biggest thing would be ask questions, ask for money, ask for them to, co-brand, ask them, what support you can offer me to in turn write the product. And then they might say, hey, cool, we can help you with this, but I also want to walk you through my training. Perfect. Cool. I think that's a fair trade. So I would be, highly shocked to see an agent, not want to utilize support. But that would be my biggest suggestion for a new agent. Ask Lewis stuff. Ask, your other agents that have large books. Where did you start? Is it, can I do a ride along with you? Is what I recommended with my team a ton too. We want to get you, either docked into a phone with a seniored agent, just so you kind of understand the workflow, or, once you get you in a ride along so you can see how a presentation goes, just so you don't fall flat when you get into a home.
Got it. Beautiful, beautiful. Okay, go ahead and proceed. I have two questions, but I'm going to wait until the next topic you were going to talk about.
Okay, perfect. No, that sounds great. So yeah, AEP is going to look very similar in terms of you can write as many plans as you want. It's unlimited. Last app counts. Same thing for OEP. So it's going to be like plan to like plan. So someone can go from MA to MA, MAPD to MAPD, or they can go from MAPD back to original Medicare. So that's going to stay the same. Those rules are going to stay the same. But starting in April of next year, how we talked about last year, they went from 4 levels of LIS to 1.
Yes.
LIS is no longer going to be an election period starting in 2025. What also we need to look at is, I'll have to send y'all more information. We may have to do another call on this. If you're not familiar with what HIDE and FIDE are, it's 2 acronyms going around that's talking about different levels of how Medicaid is going to be looked at. This is probably another 45-minute conversation, but essentially there are going to be 17 states out there. Texas is one, Tennessee's one, Florida's one, California, essentially the big Medicare enrollment states. They're going to move a quarterly enrollment to every single month for a DSNP in HIDE-FIDE states. But there's a catch. The catch is you can only move someone from a DSNP plan if that D-SNP matches their Medicaid. So you will now need to know in 2025 who their Medicaid provider is. So if we know next year, I'm just throwing these names out there, Blue Shield and, Humana have the Medicaid bid. If you want to change someone into a Medicaid plan, D-SNP to D-SNP, you can't go quarterly anymore. You can go monthly, but the conversation instead of is going to be, do you have Medicare's Parts A, Parts B? What additional cards do you show your doctor? It's going to be, do you have A and B? Great. What cards do you show your doctor? Do you have Medicaid? Fantastic. Who is your Medicaid through? And if they say, oh, it's through Humana and they're on a United Healthcare plan, perfect. We can move that person because the plan matches their Medicaid. Now, I know what you're thinking. Well, Jeremy, talk me through it. What about the other 33 states that are not Heidi-Fighty? Those folks will no longer have a quarterly for a D-SNP. So those folks are going to fall into the normal MA world of only being able to enroll with a valid SEP. So we're going to see, watch these, we're going to see a lot of more folks lean on 5 stars, move SEPs. We're also going to see folks that lean on the FEMA disasters. So like tornadoes, hurricanes, things like that. We're going to see folks using that SEP a lot more. And then what I've heard, I'll have to confirm this, is traditionally with the MOVE SEP, it was based on service areas. I'm fairly confident in 2025 they're going to lower that requirement to zip codes. So if someone moves down the street and changes zip code, they still may be in the same service area, but they will be able to move using that SEP. I need to confirm that, but I saw that in an email last week.
Okay. Man.
So a little bit of changes. So this year's going to be good. This year's fine, but next year, I'm calling next year the year of the C-SNP. We're going to see folks that lean on C-SNPs a lot more because those ones you can enroll monthly for a C-SNP. So we're going to see C-SNPs more prominent next year. We're going to see, I know y'all, I don't see any faces on this camera, but I know folks just thinking, shoot, well, I want to sell year round, but now I can't do that. Well, the catch-22 of that is if you can't enroll that person, well, neither can someone else. So it's going to be a good retention piece. But also, this is going to, I saw someone in the chat ask a question about, tell me about RetireFlow. Do they do ACA? Jessica asked that. They absolutely do ACA. So next year is going to be the year of the senior market advisor. We're calling it here. That's why our company's called Senior Market Advisors, is we're going to see like cross-selling machines next year. Folks that sell ACA, hospital indemnity, cancer, annuities, supplements, if they can, pass underwriting, shopping those Plan Gs. So next year, once we get done with OEP, I think we're going to start seeing, a new wave of agents that's going to have to cross-sell in order to stay relevant year-round.
Oh, man. Okay, we have to book this Heidi and Fighty deal because you kind of, and I'm sure for a lot of us are like, what did you just say? I mean, it is like, whew. And I know it's 45 minutes. We'll focus on it. Maybe we'll get it in the book soon. Okay, I do have 2 questions. One, do you think RetireFlow will be effective with ACA under 65 in collecting doctors and meds?
Yes, so RetireFlow does have an ACA arm as well. So you can do Medicare, but you can also set it up for ACA as well.
Beautiful, perfect. Okay, next question. The ANOC checkup should be done on all of our book, including duals and LIS beneficiaries.
I would review as many clients, if not all of them, as possible. Especially with this year, plans are going to start looking at narrowing a formulary or asking step therapy or asking for prior auth. So I would never assume a drug that's, lisinopril or gabapentin, is a small one, to use. I would never assume that it is going to be covered in the next year.
Perfect. Perfect. Okay, two more questions just popped up. Is Heidi and is it Heidi and Fide? It's HIDE and FIDE. Is that yeah?
Yep.
So that's how you spell it. No Y's at the end. And
Yep.
then okay, so we're good. It was just a comment. So
Perfect.
man, let's visit Jeremy for sure. And I'll send you a link or a date. Maybe we can get in here
Yep.
and dive down into this Heidi and Fide deal because
Yeah.
man, that's gonna be I'm in Texas, so we're gonna deal with it.
Yeah, for sure. Yeah, for other states that aren't Texas, it's going to be a I'm sorry I can't help you today, help you today conversation unless there's an SEP. So you guys are in, a battleground state for lack of better terms. You could realistically, enroll someone, every month. So there's more opportunity. It just has to be a match, with their Medicaid. So yeah, FIDE, fully integrated dual eligible, and then Heidi is highly integrated dual eligible, just so you know what the acronyms mean.
Okay. And then when you mention LIS 4 and 1 coming together, do we have a chart yet on what LIS, are there going to be a 1, 2, and 3 levels, or is it all going to be just one deal?
Yeah, it's going to be one level for LIS, and then in 2025, LIS is no longer going to be an SEP.
So they either have it or they don't. There's going to be no level and no percentage.
Yep, they have it or they don't.
Okay, so if they have it, well, in the past it eliminated the donut hole and it lowered the co-pays and all that crap. Now, what is it going to do?
Yeah, so it's still going to be the the subsidy that's going to handle their drugs. I need to get my hands on the specific percentages because I still see, Slim B and QMB plus, I still see those things thrown around. So I just want to make sure I'm understanding the process as well. So I can take that back for our next section to, understand, I haven't seen the 2024 or 2025 chart for LIS yet.
Me neither. I've been looking for one because I've got a smart book and I need to update it. And I'm like, okay. So guys, what I'm hearing and what you should be hearing and comprehending is we got some more knowledge that we need to acquire for 2025 AEP. So why don't we get on it, Jeremy? I'll send you an email and let's hook up on another date. We'll do Heidi Fide. Maybe we'll talk about LIS. And we'll continue on just preparations for 2025 AEP. Guys, any final questions for Jeremy? He's got a roll. I got a roll. What do you got? Let's see here. Nobody's kicked me up so far, but I think we might be good, man. Jeremy, thank you, man. I appreciate it.
This is great. Yep. Call me back anytime. As soon as we, this is what I do every single day. I chat with, the national reps for the carriers, so I'm leaning on them for insight here and guidance. So, any questions y'all have that I don't know the answer to, I can take it back to, Anthem or Cigna or, Humana, any of the carriers and say, hey, how are you navigating this? And we can start putting, action steps in place. I'm excited. Some agents I've talked to say, oh, well, it's going to limit what I can sell. And, it's a new era. It's more opportunities to put more products in homes and, more opportunity for you to have actual conversations of, man, I think it would be in your best interest to do a presentation, just so we know we're not leaving dollars on the table and you're saving some dollars as well. So, all good things. As soon as I get more info, I will certainly send it y'all's way, and then we'll be looking forward to our next sessions together. Happy to be here.
Yeah, hell yeah. And then guys, I would tell y'all, start preparing. You can spend a lot of windshield time and drive around all over the city or state and talk to your clients. I would become very familiar with Zoom, how it works. Go get you a free account, guys. Zoom it's free. You don't need a paid version for you to do a one-on-one. You need the paid version if you're going to have a bunch of people, but you'll be doing a ton of one-on-ones. Agent CRM, the CRM that I use, I think for $10 a month, you get a built-in agency, Zoom somehow, whatever. But anyway, you just got to figure out what tool you're going to use. And if you're going to sit in front of a computer all day, you've got to become familiar with this kind of chat feature where you get to screen share and record your conversation and save it for compliance purposes. All right. A lot of thank yous, Jeremy. Ton of thank yous, man. So you did a great job. Again, thank you on my side, and we will hook up with more training dates. Thank you.
Awesome. Thank you, Lewis. We'll chat soon.
Okay,
Bye.
you're welcome. Have a good day. Bye-bye.